Well, Breast Cancer Awareness Month is upon us, and this morning we're taking a closer look at how breast cancer impacts women of color and what can be done to improve the chances of survival. Take a look at this. Recent research conducted by the American Cancer Society shows breast cancer has surpassed lung cancer as the leading cause of death among black women. Black women are also less likely to be diagnosed with breast cancer, but 41% are more likely to die from it. Black women are also twice as likely to be diagnosed with triple negative breast cancer than white women. Black women also have a higher incidence of inflammatory breast cancer, which is a rare and aggressive form of cancer. So this morning we're joined by Dr. Arif Kamal, the Chief Patient Officer at the American Cancer Society. Good morning, Dr. Kamal. Thanks for being with us this morning.
Good morning. Thanks for having me.
Just rattling off all those statistics, it's really scary. Right? I mean, for women of color, can you help us make sense of all of that? I mean, do black women actually have more risk factors that make them more susceptible to die from breast cancer?
Well, I think really the story has evolved about, where those differences come from between women of color and white women. And that story, first, let's just comment by saying those are sobering statistics. And not minor differences that we can sort of, frankly, explain away by the differences in biology. What we do know is that all women in the United States, about 75% of them get a mammogram, and we don't see disparities in mammogram rates between women of color and white women. So, it had been thought for a long time that this was really a difference in getting the mammography done. Now, while that's good news that 3 out of 4 women get it done in time, 1 in 4 women are still walking down the street today who are at higher risk of breast cancer because we're just not catching it early. But where we do particularly see the differences for women of color is after they're diagnosed. In fact, a woman of color who has a diagnosis of breast cancer is also less likely than her white counterpart to receive standard of care, meaning the cutting edge treatments, the great things that we have, for example, for triple negative breast cancer, they're less likely to get that. And that's really important to highlight, that when women of color are sitting in front of their doctors, they really need to advocate for themselves, really bring up the idea and ask the question, am I getting the right treatment? And then lastly, it's about clinical trials. We know, for example, that women who enter clinical trials are more likely to get innovative treatments, cutting edge treatments as well. And women of color are less likely to be asked and less likely to be enrolled in clinical trials, which means they're less likely to be exposed to the brand new cutting edge things which may save their life.
Well, you're saying that there is no disparity between white women and black women as far as getting their mammogram. So why is it that women of color are less likely to be diagnosed for breast cancer?
Yeah, well, some of that is really about incidence, meaning the natural incidence. And so I think the point of our paper is really saying that it's not that black women are, 3 times more likely to have breast cancer. That's not it. And the incidence is slightly lower. It's really saying that even though if you did a mammogram for 100 women, you'd have a few less black women be diagnosed than white women, that even though that difference should seem to portray that there would not be differences in outcomes as it relates to survival, in fact, that's exactly what we're seeing.
Okay. Well, what is triple negative breast cancer, and why does it occur more in black women?
Yeah, so we're not sure why it occurs more in black women, but the reason why it's more aggressive, and this is how I explain it to my patients, is that most breast cancers have the estrogen receptor on them. And what that means is that we know the fuel that makes that cancer grow is estrogen. And, all women have estrogen in their body. And so what we do is after we cut out that cancer, we try to block that estrogen source so that it's not fueling the cancer itself.
But what is triple negative?
So triple negative is if it's not fueled by estrogen, it's not fueled by progesterone, and it's not fueled by HER2. It means we don't know what it's fueled by. It's like a car that runs whether you put gasoline in it or not, and that makes it more aggressive because you can't cut off the fuel source.
Wow. All right. Well, inflammatory breast cancer, it's very uncommon, but the research indicates that it shows up more in black women. How aggressive is that form of breast cancer, and does early detection help at all?
It's very aggressive. Generally, it shows up on the skin as opposed to sort of underneath in the breast itself. This is a good example of where both mammograms and for certain women, self-breast exams can be very important. It's very important to know what your normal breasts are like. And if you feel a difference or see a difference, to let your doctors know immediately.
And really, more importantly than anything else, is just advocate for yourself. Is that the best solution?
I think so. That and know your family history. I hear from patients all the time that, grandma had some kind of cancer, but I don't know what kind. What we know is that ovarian, stomach, uterine, colon cancer run in families alongside breast cancer. So your family may not have had breast cancer at all, but you may be at higher risk for breast cancer because of family history of other cancers. So important to know that. Get to screening mammograms. And if you are diagnosed, ask your doctor the hard questions. Am I getting the right care, the cutting edge care? And is there a clinical trial that I'm eligible for that I should be thinking about?
All right, really great advice. Thank you so much, Dr. Arif Kamal, for being with us this morning and all this great information you shared with us today.
Thanks for having me.
All right.